You're muted, Rick.
Sorry about that. Welcome to our 11 Days of Global Unity Summit panel on health. My name is Rick Ulfik, and I'm founder of We the World and the We campaign at we.net. And I'm the co-creator of 11 Days of Global Unity with my dear friend, Troy Lush. I want to thank Jim Garrison and Rick Buckley, along with Ubiquity University and Humanity Rising, for broadcasting all of these 11 Days of Global Unity Summit panels. I and we greatly appreciate your partnership and collaboration. You can find out about all of the 11 Days of Global Unity broadcasts and events by going to we.net. And we encourage you to collaborate with us as a volunteer or an organization partner as well by going to we.net. Today, for our 11 Days of Global Unity Summit panel on health, I'm excited to introduce you to Kathryn Davis. Kathryn Davis is producer and host of Heart of Mind Radio at heartofmindradio.com, which is broadcast on WBAI Pacifica Radio and PRN Progressive Radio Network. Kathryn is also a meditation and movement teacher, a Qigong teacher, and Kathryn is coordinator of the health campaign for We the World. Welcome, Kathryn, to the broadcast, and please let us know what you have in store for us for talking about health today.
Yes, well, today I wanted to share from the perspective of my own experience and the impact that a lot of the crises have been having in my life and in my family, in the sense that I think this is what everyone on some level is dealing with, that we know someone or someone close to us may be struggling with different kinds of ailments or diseases, and we want to help them. We don't always know how to help them, but I think that information is at the top of what we can do. So, and then we can also hold people's hand as they go through their challenges. And you can hold your hand, a person's hand, virtually, on the phone, or even in person when you're close enough in the world to be able to do that. And I feel that it makes a significant impact on how people's outcomes will ultimately be. And I also wanted to start out with a little bit of information on the state of the virus in terms of the vaccines. And we've been seeing a lot of rising because of the the new strains of vaccines that are coming. And I think that this presents a danger to people. So I just wanted to give a little bit of a encouragement that people should really think about what they need to do to maintain their own health in regard to this as well. And so, and I've been looking at studies around the world and seeing what statistics are. And there's a lot of important information that we can derive from that. So I'm going to talk about that, as well as a little bit about a healthy diet. And I think what may be more important, or at least equally important to a healthy diet, is being able to maintain our state of mental health, because the state of our health and stress is a very large cofactor in many, many ailments around that people have. Stress is a big cofactor, and we have to focus on really raising the level of importance on how we deal with stress in our lives. So those are some of the things I wanted to share today. But I'd love to hear what your thoughts are, Rick, on some of these ideas.
Sure. Yeah, so for me, nutrition has always been a huge factor in my interest in health and well-being for myself and others. So one thing that I wanted to bring up was I recently saw a documentary, and it's called Blood Sugar Rising. And it's a PBS documentary. And one of the striking things in it about the epidemic of diabetes in the United States is that I think they said in 2010, 3% of adults had diabetes. In 2020, it had risen to 10% of adults. And then they project by 2025 that 50% of the adults will either be pre-diabetic or have full diabetes by 2025. And that's really extraordinary. That's like over 150 million people. My God. So it's a real epidemic that isn't being talked about. And one reason may be because the commercial food companies that make soft drinks and fast food and processed food, they are the advertisers on mainstream media. So there's a good chance that talking about alternatives to them is probably not something that the major commercial media want to do. And yet, this is such a thing that's destroying families and people, right?
Absolutely, and I think it in many ways goes hand in hand with other epidemics, such as the epidemic of poverty. So those people who are growing up in areas where they don't have access to healthy food, or perhaps they can't afford healthy food, rely upon the dollar menu to feed their children, rely upon these fast food places to just not be hungry. And I think that that adds to it, but also all of the sugar and salt that we find in products, even things that allegedly look like they should be healthy aren't necessarily healthy. So I've shopped in a health food store and found foods that are not really very healthy because they're made with additives and products and grains and salts and sugars, or if it's not a sugar, maybe a sugar substitute that's not so healthy. So it's a big issue in our country, and I would love to see our agencies, our health departments, our CDC, to really begin to look into wellness. And I think that there needs to be a real shift in how health is managed in this country. It's managed based on dollars, really dollars and cents. And those things that make the most money are that which is promoted, and people suffer for it. And not everybody has access to the education or even sort of the community interaction. So when I was going to college, or if I'm interacting with people who are involved in health, people are very well informed. But when I reach out to people in my family, it's very hard to convince them that they need to change their life and change their diets and maybe do something different. And very often it takes extreme consequences to turn a person around. And I think that's really unfortunate. So I'm hoping that we can make some headway there. Like currently I have one of my brothers is in the hospital because of complications of diabetes. And he had one of his toes amputated. So that's a really terrible thing to have to happen to someone. I hate seeing that happen to my brother. But there's a frustration in trying to find a way to really reach people in their everyday lives, in their everyday hustle and bustle, and to provide opportunities for them to make healthier choices. So ultimately, that's one of the goals of our work here in the health campaign, is to help people make healthier choices so that they can be healthy in the long run. And my background gives me a certain sensitivity to the kind of health issues that arise by virtue of not having good nutrition through your childhood, or not having any education whatsoever on nutrition. And truthfully, it's only recently that even doctors are being educated on nutrition. So it's hard to compete when you have the medical establishment or the doctors saying, oh, just take this drug and you'll be fine, when mostly you need to do a lot more than that in terms of managing health and bringing oneself back into health. So I really feel very strongly, because I see it happening in my family and I want to do something. Another thing that I experienced last year is, my eldest brother passed away from COVID-19. And so that was another loss. And he was in his 60s, early 60s. He wasn't extremely old. He was working full time, but he was in fact I guess what you would call an essential worker. He was an electrician. So in his travels, he was exposed. But at the time that he was exposed was just after the time that it was before the vaccines, but it was while he was in a southern state, and when the southern states were opening back up, saying that there's no more danger. So he had been managed to get through the whole year without becoming infected. But once they opened up the state and everybody started running around, he did get sick. And then the other part of that was really a problem, that I think is an ongoing problem, is that he was not able to receive any help at the hospital, not because they were overrun, though they may have been. The problem is that they don't have early treatment, or they don't consider early treatment a factor. And so I remember when the virus first started here in New York City, they were telling people to stay home unless you get really, really sick. So people were sent home. They were told not to wear masks at that time. So they ended up spreading the virus exponentially in their families and communities. And then people stayed home till emergency went to the hospital, and then were put on the intubation machines, which, as it turns out, were not effective. They didn't know it at the time, but it turned out to be a bigger problem than a help. So I just think that, keeping people up on information is really important. And I don't usually talk about COVID-19 per se, because it's such a hot button issue. But I wanted to share some statistics to remind people that they need to be careful, that even people who are being, completely compliant, fully vaccinating themselves, looking for the third vaccine, that they're still vulnerable. And though I think it's true, and it seems the statistics bear out that it does reduce symptomology. So people have much milder cases if they're vaccinated. However, they can still pass it on, because it's just as active in a vaccinated person as an unvaccinated person. So that means that you might have been vaccinated, if it was more 6 months or more ago, it might have worn off. Then you might go and visit, an elderly person in your family, and you could potentially transmit the disease to somebody that you love. So I just want people to be careful and understand that that's the case. And and one of the real tragedies about our media is that it tends to, the mainstream media, they tend to want to jump on a bandwagon, and they don't wait till they have all the information or the research. And nobody knew that the vaccines would start to diminish after 6 months. We were always unsure whether or not the vaccines would be viable for the new strains of virus, and they don't seem to be as much the case. So it's just one of those things where information can save your life. So I'm just going to share to let people know, or to be able to see. Hold on a second, let me make sure I have it up. I want to share a particular statistics with folks, just to give an idea of what's happening. So this here is a basic statistical chart, and it comes, the statistics come officially from the countries that they're from. And so you can, and this is basically just showing vaccinated rates against COVID. And the United Arab Emirates is up to 90%. And then it's pretty high, and it gets down to Great Britain is 71% vaccinated. Israel is 69% vaccinated, and the United States is 63% vaccinated. And you see it going all the way down. So when you get down to the poorer countries, you'll see their rates are very low. And this is why a lot of people are saying, well, maybe we should give vaccines to people who haven't had a chance yet, rather than taking it all ourselves in the richer countries. But there's another data set I want to share. Let me see if I can find it, because this is the part that's really shocking. So this is the rise in cases per country. This is ourworlddata.org, so people can check it out. And you'll see that even though Israel is very high in its vaccination rate, the actual cases at this point is 1,254.49. And that's the 7-day average. So that's a pretty high number for a country that's very highly vaccinated. The United States, it seems, is also very high, even though it's highly vaccinated, 433 cases, and the United Kingdom, 521 cases. So what the CDC was saying, I'm going to stop sharing for a moment. So what the CDC was saying, that even the statistics might be low because they've discontinued testing. So they only know if somebody walks in to a facility to get tested, or to get tested for a job, or they feel sick and get tested. So I wanted to really encourage people to maintain the precautions. And then I know it's hard because people initially went out and got the vaccine because they wanted to get their life back. They wanted to be able to walk around. They wanted to be able to be without a mask and interact with friends and family. And I think that that's still true. That's what people want. And I'm just asking people to take precautions, because if someone who's vulnerable does get COVID-19, it could mean their life will be over, or they could be incapacitated in some way for a very long time. So I just wanted to have a chance to put that out there as someone who, in fact, did lose someone to COVID-19, who managed to be safe until things opened up and then was exposed. that there's going to be dangers in a lot of these places where people are not taking precautions. And it's kind of a personal responsibility. You have to decide for yourself what you want to do. And I want to encourage everyone to take those steps so that they can be healthy. And so I don't know if you have any thoughts about that, Rick. You're welcome to.
No, it's actually a complex issue in some ways, and I know there is this controversy about making vaccines available to these countries that were low down on that list that you were showing. It's one of those intersections. We talk a lot about the intersections of these different campaigns, these 11 campaigns that we have with We the World and from the 11 Days of Global Unity. But health is very much connected to economic justice in these ways. The idea of making the vaccine manufacturing more available around the world, which means allowing, it has to do with the copyright protection that the pharmaceutical companies have. I mean, so that's another whole thing. But you can even, I was thinking about this and talking about it the other day. You can look at the very beginnings of COVID before anything came up about the vaccines. I remember there was a group of Nobel laureates, and I think it was like 17 of them, if I'm not mistaken, came together and had a proposal for a plan that would cost $100 billion to develop accurate, rapid testing and contact tracing. This is at the beginning stages of COVID, when it was starting to go out and everybody was worried. They had a plan for COVID, rapid COVID testing for as many people as possible, and contact tracing to isolate and find out where this was so it could be contained. So you wouldn't even need to go to that next step of developing a vaccine. And they were trying to get it through, but they could not get it through to contain the virus at the early stages.
And now that doesn't look like a lot of money anymore.
That's right. Because the whole economy, so much more has been spent and went down the tubes because we didn't do that at the beginning. And it's a non-invasive approach, but anyway, it's just too bad that happened. But then, and now we're at this point where we have this inequality of access to the vaccines, and so this is why we need kind of a holistic approach to creating a better world where all of these things are being considered at the same time.
Yeah, and I think also the other problem is the way politics define the conversation and the narratives throughout the whole thing, and I think that caused a lot of loss of life. And the other thing that I think is a problem, not just in this, but in many situations where remedies or cures or vaccines are determined based on how much profit they will bring to the manufacturers. So if they had something that they could use to help people, they won't do it because they don't, if it can be gotten for very little money, they're not going to either invest studies in it or promoted as a remedy to the problem. And the reason I say that this is important, not to have a conversation about the vaccines, but there are a lot of people who, if were treated earlier on, once they had the COVID-19, could survive a lot better. And I think there's also, if we are going to just preemptively prime our bodies to be healthier, we can do that by taking, a lot of what we talk about in terms of nutrition, in terms of the proper diet, and taking supplements, and using certain strategies to ensure that we can be in our best health, even should we come in contact with this or any other pathogen. It's just really important these days to live very defensively in terms of our choices. So I wanted to just speak a little bit about, I'm going to see if I had a little thing on the immune system I wanted to share. And this is an article from the Houston Methodist Hospital or Health Center. And I'm going to just share the screen so that we can take a look at that. So this article tells us 5 ways to boost our immune system. And so the first part is maintaining a healthy diet. And as most things, a body gets a lot from these live foods: vegetables, fruits, legumes, whole grains, lean protein, and healthy fats. And some of the vitamins that are really important to the immune system are B6 vitamins found in chicken, salmon, tuna, bananas, green vegetables, and potatoes with the skin. Vitamin C is found in citrus fruit, oranges and strawberries, tomatoes, broccoli, and spinach, as well as red peppers, I believe. And vitamin E is found in almonds, sunflower and safflower oil or seeds, peanut butter, and spinach. So those are, I think, supplementing can be very, very important, especially in defense of the potential for COVID-19. And so I don't know if this article is the one. Now, this one isn't telling us, but D3 and zinc are also very, very important for a healthy immune system to prevent this kind of outcome. So you need to exercise regularly. Physical activity isn't just for building muscles and helping you de-stress. It's an important part of being healthy and supporting a healthy immune system. And it improves overall circulation, and that makes it easier for the immune cells and other infection-fighting molecules to travel more easily throughout your body. And as little as 30 minutes of moderate to vigorous exercise helps to stimulate the immune system. One thing that people forget is hydration, water. Hydration, being dehydrated, leads to a lot of things, including high blood pressure. Water plays many important roles in the body, including supporting the immune system. A fluid in your circulatory system called lymph, which carries important infection-fighting immune cells around your body, is largely made up of water. Being dehydrated slows down the movement of lymph, sometimes leading to an impaired immune system. So different people will need different levels of water. Probably 3-4 glasses a day is what I suggest, but not to oversaturate yourself. If you're sweating, then you'll of course want to use more water. The other thing is sleep. Sleep deprivation adds to your stress level and also adds to the potential of coming down with colds and viruses and being much more susceptible. And so it's important to really take the time out to end your day and go to sleep, or perhaps get in the habit of taking naps. But sleep is really, really important to having a healthy immune system. And then just words on minimizing stress. So what does that mean? It means walking. It means doing meditation and breath practices. It means doing practices like yoga or qigong or tai chi, or any number of things you can do to help reduce your stress, because stress has a very high impact on the immune system. In fact, one of the highest comorbidities to falling to COVID or getting COVID is stress. It was one of the very high cofactors, stress, but also the drugs of stress. So if you're on antidepressants and other kinds of medications for stress and depression, that could make you a little bit higher risk. So you want to really pay attention to reducing stress when you are dealing with your immune system. And the other thing I just wanted to talk about briefly, I'll see if I can find it. I wanted to go back into the dietary thing a bit, and let's see if we can find that. I'm going to unshare my screen. Oh, okay, so this one came up. Might as well share it. 9, supplement wisely. So none of these supplements are saying that, no one in officially the NIH or the doctors or the CDC are going to tell you that vitamins are a cure. Vitamins are not a cure for anything, really. What vitamins do is help to provide you to put into your system those nutrients that are missing. And when those nutrients are present, then our system works more coherently as it's supposed to. And that gives power to our immune system to overcome these challenges. So, so this lists also more: vitamin C, vitamin D, zinc, elderberry. There was a review that found that elderberry could reduce the symptoms of viral upper respiratory infections. So that's a tool. Echinacea. 700 people found who took echinacea recovered from colds slightly more quickly than those who received a placebo. Garlic is another one. And supplementing with garlic reduced the incidence of cold by about 30%. So making sure that we have the full nutritional balance in our body is always going to make a huge, huge difference when it comes to diseased states. And so I wanted to do this research by looking at really scientific and traditional outlets and journals, not to run into any complications with information and people not knowing how to trust it. But you can actually go to the CDC, you can go to the Mayo Clinic, you can go to many of these hospital sites, and they'll be giving you the same basic information of how important it is to take care of our ground, to make sure that we're having everything that we need in our bodies to stay healthy and to stay strong. So we don't get a lot of that information in the mainstream, maybe through advertising, but not too much otherwise. And I just wanted to put that out there for those people who are listening, and you have family members who may be vulnerable. Let them know that there's a lot that they can do to improve their health, just basically, and also to improve their chances should they become exposed to any pathogen. It could be anything. If you're very vulnerable, you want to pay attention to that. And the other thing is that I really think that we can do a lot more towards our healing and our mental health. And so with that, I wanted to share a little something with people. So are you hearing some noise in the background?
A little bit, but not
Okay.
much. It's
Not much.
okay.
Hopefully it won't be too difficult. I'm in an office space now. But what I'd really like to do, this is going to be unfortunate, but I think I need to tell them.
This is the part where you sing, Rick.
Okay, now's my big chance, right?
You and Kermit, come on, a duo.
Kermit oversees everything.
Well, that
all
was
of
a
the
little
panels.
unprofessional, but
That's okay.
I
I made
should
my
have turned
my
off my
singing
camera.
debut.
Oh, good. Yeah.
Not really.
So I wanted to share a little bit of movement that people can do to work with themselves in order to just pick up the immune system. And we spoke a lot about the lymph system. The lymph system is very, very powerful. You know, it's what helps to detoxify the body, bringing in the, you know, the killer cells and taking out the dead cells and the toxins. So it's really important to have lymph moving. And when you're doing lymphosizing or those kinds of exercises, it really picks up the immune system. So I just wanted to share a little bit of that. It's really easy. And mostly it's just tapping and breathing. So I'm not going to go too far back. But generally what you just want to do is, you know, sort of with the palm of your hand, tap through the body. So I'm going to do the side of the neck and up along the shoulders. And then tap on the outside of the arm, going down, and the inside coming up. And then tap into the chest. We can do the other side, starting with the neck and down the outer arm, up the inner arm, into the chest. And we want to really tap across the chest to really get the energy flowing. And I'm just going to angle down a tiny bit because you also want to do your tummy. And so when you're doing want to move through this part of the body and just get things flowing, you just tap down all the way down a few times. And this helps to straighten out the digestion. And for elimination, you tap across the belly and down and just move around. And the circular motion should go up the right, across the left, to the left side and down. So for you to see me doing, I'll do it opposite. And this really gets some of the toxins out of the lower body. And it really helps a lot to, if you do that every morning, you could tap through all of the lymph glands in your body to really just help get the energy going. And another nice exercise that I want to do is basically a breathing exercise. And so it's just lifting your hands up with your inhale. So it's inhale, exhale, inhale, exhale, inhale, exhale. So I'm rising on my toes for those of you who are standing. And what this is doing, as we rise up to that peak point, before you come back down, then your body becomes weightless. And in that weightlessness, it pumps your lymph system so that it's like a heartbeat to the lymph system. And this is an exercise. So you would do it in maybe counts of 33, or you could do 66, or you could go all the way to 99. But if you were to do that kind of exercise every day, every morning, it would improve the quality of the lymph system. And just through the movement and the breathing, you could have a big impact on the quality of your health. Very easy things that we can do even before getting out of bed in the morning in terms of the tapping. And then once we get up, if we do the breathing, it's lymphosizing, but it's also oxygenating the body, circulating the blood, and helping to move the lymph through our system so that we can have a much healthier lifestyle, a much healthier day. It lifts our energy so that we can move through the day with a little bit more energy. When we're doing these exercises, we don't want to do them to excess. So that's why I said do it, maybe 3 is enough for a person who's not feeling well. But the highest you would want to go in that breathing practice would be 99 repetitions in order to improve the state of your lymph. And I'm just giving this as an example because you're going to find these exercises in all different kinds of practices, yoga, Tai Chi, Qigong, or even just going for a walk or going into the gym and doing some slow, gentle movements. We want to move with our breath, opening, expanding with your inhale, relaxing with the exhale. And so those are just a few things that we can do to improve our health, along with changing our diets and making sure we have supplementation. If we don't have access to the right foods, supplementation is really not too difficult to come by. It's always best to look at the ingredients, and anything you can get that's as pure as possible without additives is the best way to go when you're using supplementation. And it's always good to do a little research on supplementation. So for instance, both of those, or at least one of those articles, where I think both recommended zinc, but what they don't tell you is that zinc is not easily absorbed. So if you're going to take zinc, you should also take quercetin as a supplement, because quercetin grabs the zinc and takes it into your body, into the cellular structure. So while it's maybe a lot of information for people, I just think I wanted to recommend that everyone begin to take this journey down this path. And part of the work of this campaign is to be able to make all this information digestible so that people can get the information and they can use it and apply it to their lives, and just to make it better, improve for everyone, all of our states of being. And I also wanted to encourage everyone to really reach out to people, because we don't know who's vulnerable where or when. And sometimes a kind word could make a significant difference in our well-being. I, for whatever reason, I was wanting to make this personal, but I spoke to my brother before he went into surgery. And he was despondent and he was afraid, and though he felt that this was the best choice for him, he was really not in a good state of mind. So I spent a good amount of time just talking to him and encouraging him, and working with him in terms of going into the surgery with a positive state of mind, with mantras, with confidence that his body knows how to heal itself. And so I did what I could, but when I spoke to him afterwards, he was like very cheerful, and he was like, wow, it made such a difference that you took the time to talk to me. And he really felt like it made a difference for him, his whole experience. And I think that this is something that we can do for each other. It doesn't have to be as serious as a surgery. Maybe there's an elderly person in your building who doesn't have family. Maybe there's, you have relatives who are in a state that you can't really connect with them. And so this has reminded me that I need to really start reaching out to my family and friends just to see how they are. And this is something that's going to contribute not only to their health, but your health, because that means that you're not isolated anymore, sitting in a corner somewhere or fearful of contact with people. You know, these are lovely platforms that allows us to get really close. We can look into a person's eyes and really see what they're feeling and what what's going on with them. And we can lift each other up. And I just think that this is an important part of the healthcare picture, that it's not even all about medicines and foods. It's about opening up your heart to someone and being patient and kind with people, even if it's the guy at the grocer, you know, good morning. I think we just need to be kinder to each other overall, so that we can transform the world we're living in through that kind of one-on-one kindness. And I'm convinced that it heals and it helps people to heal. And if enough of us get into that and start engaging with it, a big piece of the world will heal. I can't speak for the media because the mainstream media just drives me crazy. I don't know if it will ever heal. I hope so. But what we can do is stop giving it such a big piece of our energy and start spending that time doing things in the real world or engaging with people on the phone or on platforms such as this one. Listening to programs that are encouraging and inspiring, because if not so, we can be very easily drawn by the messaging that's being put out there, and it starts to make us feel depressed and fearful and suspicious and angry. And that is what is leading to a lot of conflict. Just like you said, Rick, in the beginning, these people had this wonderful idea on how to contain it. But because people weren't really thinking of other people, they were thinking about dollar signs, I'm sure. They didn't want to do it. And as human beings and as the world community, we have to demand and be active to our representatives to make sure that people's needs are cared for. And it's not all about the bottom line. I think we have to and understand that for ourselves as well. So if we're working in a job that's killing us, maybe we just really need to leave and do something else, or renegotiate and say, look, I can't work from 9 to 10 every day and survive. So I think we have to stand up and advocate for ourselves with regard to our workplaces and with regard to the government, but also even in our own lives with ourselves, because most often we are the taskmaster that is, you know, bopping ourselves on the head. Keep going, don't stop. You can do it. I can handle it. And before you know it, it's too late before you realize that you can't handle it. And so I just want to bring our life and our humanity to the highest priority. And I think that's what we need for good health. One of the things we need for good health.
Yeah.
So those are just some of my thoughts. I don't know if you have any thoughts to add to that, Rick.
Yeah. So I think what you're talking about is a holistic approach to health, starting from yourself. It's not just, let's say, food and nutrition. It's also, it's like, you know, mind, body, emotions, and spirit, right? All of those things combined for optimum health. Body is one of those, but how you are thinking of things and how you approach yourself and others in terms of stress, that can affect your body. And then that same holistic approach to health, you can take that outside of yourself, as you were saying, when you connect to other people and you inquire, how are you doing? Just that act of connection actually improves your collective health, your health, because humans are community-oriented creatures. So you're actually meeting a need by connecting with other people, and then they feel that you are concerned, and you then feel that they are concerned about you, and all of those things can help. I also wanted to get back to this idea of health connecting with some of the other areas of concern, like the 11 campaigns that we have, because when we are expanding our circles of caring and connection, then what we are doing to ourselves, we realize that what we are doing to ourselves actually affect others, and vice versa. So in an earlier conversation, I was talking about this realization that people had in the 1990s, that consuming things like hamburgers was actually affecting the Amazon rainforest. A friend of mine named Bob Blake was a creative director at one of the ad agencies, and he created an ad campaign to show that when you are eating hamburgers, you're actually helping to clear the rainforest in the Amazon. And he had this image in the ad campaign where you have the buns, the top and the bottom bun of the hamburger, but in the middle, instead of a hamburger, you see all of the life forms that are in the Amazon rainforest. The panthers, the forests, the primates, all of these creatures were being killed as the rainforest was being cleared to raise cattle. And it was being cleared at an extraordinary rate, which was at its peak, I think, the size, the area of the country of France being cleared in a single year to raise cattle for hamburgers. And now this idea of when you're eating meat, with factory farming and industrialized agriculture, we know that contributes to climate change as well. These factory farms, there's methane that comes out of the cattle. The deforestation means that there are less trees to suck in the carbon from the atmosphere. So it's all connected to what's going on. So if you connect what you are eating to your own health, you can also connect it to what's going on in society. And of course, there are others, the indigenous folks. I think you had an experience in Ecuador where the indigenous people are also being affected by
very deeply impacted because their whole culture is taken from them. And my experience in Ecuador was that they were just, cutting away all the trees, and the trees hold the soil, so they were flooding, and the indigenous people, like I looked into their eyes and they were like, I won't say hopeless, but just, dumbfounded that anyone would want to do this. And they didn't know what to do. In fact, there was one little girl who asked me to take her home with me because she wanted to escape it all. Of course, I couldn't do that, but it was very sad, and indigenous people are suffering all across this country, Central South America, probably other places as well, in coming into conflict with money, corporate money, whether it's cutting down the forest, whether it's digging up oil, whether it's digging up minerals. There is no real justice in terms of the poor people that are being exploited, as in order to support these companies. So in the end, there are people on the stock market, and I would ask them even more so, what's in your stock? How many people have died for you to make that couple of bucks that you've made on that particular stock? And hopefully, more people will become conscious and demand more. Not that we want to stop companies from existing or people from making incomes. I have no problem with that. But we have to stop doing it as a death culture, causing such great harm to people around the world. So there's a lot for us to work on, Rick, because all of these stories are interwoven, and all of these consequences are very much interwoven. And that's why the invitation is always out there for people to join the We campaign, and so that we can do a little bit more and hopefully spread the word a little bit more, and open people's awareness to what's really happening in our world. And in the meantime, though, take care of yourself, because you can be an activist and work yourself, to the bone, and then there's nobody there to take care of you. There are no services to take care of you. So yeah, we have to start understanding that just because somebody looks different doesn't mean that they're not our relatives, and that we need to take care of them too. And the earth herself, from which we all come. If we don't take care of her, we're all done for. So it's a tough conversation, because the money interests are very powerful, and they impact every facet of our life. So in many ways, we just have to just keep going. I don't want to say struggle, because I don't think it's a struggle. It's really joyful to do beautiful things in your life, to take care of yourself and take care of other people. You can really live very happy and with a lot of meaning this way. I can't promise you'll be a multi-billionaire, but you can be happy and have meaning in life and make a difference, saving lives. If it's with information, if it's with a pat on the shoulder, if it's maybe a drive to the doctor. I just want us to get more basic in understanding how to go forward, that as much as there's this activism, we can have an impact in our individual lives by our individual actions.
Exactly. And for me, this is about this idea of expanding the idea of we and we consciousnness, right? So people, when you think about we, you probably think, my close, my loved ones, family, loved ones, my friends, what are we doing on the weekend? How are we doing? But do you include your pets when you talk about your we? Do you talk about, or do you include your plants when you talk about your we? Do you expand to your community, the greater community of people and other life on the whole planet, and even the ecosystems that support life on the planet? That's kind of what we're going for, the expanded concept of we, that we are all in this together, and we are one. And what does that mean? That means that the health and well-being of each and every member of society, including our animals and plants, that the health and well-being of each member is essential to the whole of society, the whole and the survival of society. So if a person in your particular community has COVID, then people realize that the survival of the community may be in danger because of that person who has COVID. But how about if a person is homeless in society, in your community? Do you think of it in the same way? Do you feel like your community is in danger because you see someone who's homeless there? Do you get that same sense like, oh my God, there's something wrong here if there's someone who's homeless? Suppose there's someone who's discriminated against for whatever reason, their sexual orientation, their ethnic group or religion or whatever. Do you get that same sense that the well-being and even the survival is in danger? You know, like I used to have a car. I don't have a car anymore, but every once in a while I'd hear some kind of noise in the car, and I realized, uh-oh, there's something wrong here. And sure enough, that could mean like the end, or you know, the whole thing would have to be taken in, or something like that. Are we thinking the same way when we see one problem like a homeless person or one person who has a problem? And that is the expanded consciousness of we. Do you think, Kathryn?
Absolutely, absolutely. And it's also, I find a real plus to be able to be part of a community that you can resonate with in this regard. So it really does sort of mitigate the hopelessness you might feel by looking at the mainstream television. So it's really nice to be here, to be able to share with people and grow with people. I would say that the health campaign still needs help. And so if anyone is out there and wants to join in and volunteer sometime, you would be welcome.
Exactly. Well, thank you, Kathryn. This has been a pleasure talking with you. Thank you for sharing the ideas, the statistics, and your approach to really connecting with yourself, all the different parts of yourself to become healthy, and then expanding that consciousness outward into our community and our world. So people can connect with all of the campaigns, the health campaign, Kathryn, and all of this work that we're doing, and our partners. Thank you again to Ubiquity University, Humanity Rising, Jim Garrison, Rick Buckley, and the whole team for broadcasting all of these things. So you can connect to all of this by going to we.net. So as our dear friend said at the launch of the We campaign and the launch of we.net in 2009, our friend Jonathan Granoff, he gave the keynote address at the launch event, and he said, I hope that we expands so much that there is no longer any them. So thank you. Thank you all.
Thank you.
Thank you.